I'm responsible for the overall management of the PATH project, and that includes a number of things. One of those early on in the project was working together with the PATH partners in developing a structure that would enable them to work together effectively. I'm also responsible for the overall progress of the 5 project element teams. Over the late summer and early fall, we were developing those foundational pieces of the project, and at the same time over the fall, we embarked on our gathering stories phase of the project, using focus groups for the provider group. And so what's happened with that, all of those stories are now completed. They were all audio taped and have been transcribed and are currently being analyzed. Also during the story gathering phase, we started developing the project element teams and completing the charters and the scopes for each of those projects, as well as the terms of reference for the project teams themselves. How are they going to work together? We also have developed a one-day education module that will kick off each of the project element teams and provide the patients and caregivers and providers on those teams with how experience-based co-design will be used during the project work, as well as how the principles of gerontology and technology can be used to help us enable those changes that they come up with. One of the challenges is the sheer number of partners for this project. I mean, none of us are used to working with this many partners, so I think that the time that we took at the beginning building that foundation really has helped us not get bogged down and helped us move forward. Well, I think for me, and I think for all of us, I mean, we recognize how complex the healthcare system is and how difficult it is to make changes in such a complex system. But I think we all have a belief that the use of experience-based co-design, having patients and caregivers and people who use the system at the table with the providers, along with a community-wide partnership, the two of them together, I think that's what's going to make the difference. I think one in of itself they would have some success, but those two things together we believe are going to make the biggest difference. And so if we are able to demonstrate that in Northumberland, then it should be quite easy to take the processes of methodology that we have used and spread that across the LHIN, the province, Canada, and really beyond our borders if we're successful, and we believe we will be.